The death toll in the Ebola outbreak in 4 West African nations, Guinea, Sierra Leone, Liberia, and Nigeria, rose today to at least 932. To remind you, Ebola is spread not through the air, but through contact with bodily fluids, including sweat, saliva, and blood. Debora Patta has more tonight on the battle to stop it.
A top Liberian health official tells us that there may already be hundreds more fatalities than have been reported, and the outbreak is going to get worse. One of the epicenters of the disease is in Liberia's capital, Monrovia, where there are only 2 treatment centers. One of them only has 18 beds for Ebola victims. This means that many infected people are being left to die in their villages without any medical care. This man's body was dumped on the street. A 60-bed capacity treatment unit is now being constructed, but the health department says it is not enough. On the front line of the battle, many health workers have died. Officials say it's because they don't have proper protective gear or adequate training. But it is fear of the disease that is causing more harm than the disease itself.
We go use sanitizer.
Teams are now patrolling neighborhoods to educate the public on how the disease is spread. But many believe isolation wards are in effect a death sentence, causing people to hide sick relatives and bury their bodies in secret. What is different about this Ebola outbreak, Scott, is that it's the first time the disease has spread to urban areas. Places like the capital of Liberia, Monrovia, home to over 1 million people, have been hardest hit, and trying to contain this virus in a densely packed city centre is proving to be extremely complicated.
Debora Patta reporting from Johannesburg, South Africa. Thank you, Debora. And late word in this country tonight, New York City health officials who say a man who arrived from West Africa with high fever and gastrointestinal symptoms is not infected with Ebola, as had been feared.